All right, welcome to our live stream at Deuk Spine Institute. It is November 7, 2023. Our patient has two herniated discs in his neck. He's traveled here from Palm Beach, Florida. Shot. And we're going to fix those two herniations. 2, 3, 4, 5, 6, 7. So this first step is accessing the discs through the front of the neck, and we do that with our needle. Shot. 2, 3, 4, 5, 6, 7. Shot. Perfect. Shot. AP. Quick AP. I want to make sure that I'm in the middle of the spine. Quick shot. Nice. Lateral. So I'm a little bit to my side. I have to go a little more towards the other side with my fingers. But other than that, it's looking good. Excellent. And shot. Perfect. AP. 2, 3, 4, 5, 6, 7. You all agree that's 6, 7? Quick AP. Very nice. We're right in the center. I'm going to advance the needle into the disc at C6-7. You can see we're right there in the 6-7 disc. Coker, AP. Very nice. So the first step of the surgery is accessing the discs through the front. And I always go for the more difficult disc first, in this case C6-7, and then I move my way up to the easier disc later, 5-6. All right, so let's count. Sanjay, counting on the x-ray. 2,
Yes.
3, 4, 5, 6, 7. Very good. Now we're going to do a discogram. Now, this is not an evocative discogram, it's a chromodiscogram. Shot. And shot. All right, I just injected the dye. Let's get a little shoulder pull. I want to see the dye better. Shot. Shot. That's nice. Shot. Oh, beautiful. You can see the dye coming out through the back of the disc. That's good. Relax. 2, 3, 4, 5, 6, 7. Everyone agree we're at 6, 7? And that is one of the discs we're fixing, correct? So we're at the proper disc. We're going to inject a little local in the skin. We're going to make a 4mm incision. We're going to do the entire surgery with a 4mm incision. 4mm is very small, in case you don't know. Shot. It's just wide enough to put our endoscopic tube. The endoscopic tube, of course, is a metal tube made of surgical stainless steel that we use to put the endoscope down through that tube so we can do the surgery. Before we do that, though, we're going to use the dilator. The dilator is a little pointy metal pencil-like device. Shot. And what it does is it spreads tissues. Shot. It doesn't cut, it spreads. And what we're spreading here, shot, is the soft tissues within the neck. It doesn't matter if it's muscle or connective tissue. All these tissues under the skin have one thing in common. Shot. They're fibrous. They have fibers. AP. And what that means is, because they have fibers, you can spread the fibers open, move them apart, and that's what the dilator does. Beautiful. We're in dead center. Show us the center, Jordan. Look at the center of the spine right there. Perfect. Show us the endotracheal tube. Yes. Show us the esophageal temperature probe. Yes. Show us the dye in the foramen at C6-7. Yes. It's wrapping around the nerve roots on both sides. Very good. All right, any questions from our audience?
No questions.
Excellent. At this point, I'm going to be advancing this dilator through the anterior annulus at C6-7 all the way to the back of the disc. Let's get a little shoulder pull, just a little bit. Shot. That's plenty. Thank you. Shot. It's perfect. Go ahead. Folks, we're going to do the entire surgery through this tube. Can you see this tube, Sanjay?
Yes, I do.
It's 4 millimeters across from one side to the other. You can relax a little bit. It's too much on the shoulder, just a little bit. Just enough so I can see the disc at 6-7. Now our last patient we did today, he had a really nice neck, a perfect neck where you didn't have to pull it all in the shoulders and you could see 6-7. But we have patients that you have to pull a little bit and you have patients you have to pull a lot. And this patient we're just pulling very little. The first patient we didn't pull at all. Shot? Perfect. All right, now I want to bring the dilator down just a little bit because it snapped back because of the pressure inside the disc. Remember, the reason we're here is something called inflammation. Hold on. Inflammation is the cause of this patient's pain in his neck, down his arm. We're here to get rid of the inflammation by removing the herniated disc and cleaning the annular tear where the inflammation is occurring. All right, let's do this. Before you do that, let's clean up. Sanjay, you want to get some pictures?
Yes, Dr. Deuk.
All right, so I need to clean up a little. I need some liquid. All right. So let me just wipe some of this stuff off. And, all right. Let's have a dry one. All right, Sanjay, can you see this?
Yes, I do.
Let's get our hands in here, Luis, so the audience can actually see what, just for reference. This is a nice one for the website.
Yes, Dr. Deuk.
All right, can you see that?
Yes, I do.
The entire surgery done through that little cut.
Yes, we can see that.
All right. Okay, let's go ahead and bring the scope in. Let's run our video showing our audience why do herniated disc, like this patient's herniated disc, why do they cause so much pain?
Playing
Okay, welcome back. We're now down at the bottom of this tube, which is right inside the herniation and annular tear. right where you see all the inflammation on the video. We're going to use the laser to clean out the herniation. You all see the blue right there? That is the herniation.
Yes, we
And the
do.
white is the annular tear. We were just talking about, this is a German-made, designed, and manufactured scope system that I use. Oh, we have something special today. Look at that down there. That is the posterior longitudinal ligament at C5-C7. Just behind that is the spinal cord. Anyway, we were talking about how I'm disappointed with, German design and engineering and manufacturing because it's so good. It makes you it makes the rest of the stuff out there look bad. For example, my favorite thing Germans make is German chocolate ice cream. Anybody ever had German chocolate cake ice cream? Yeah? It's my favorite. Of all the ice creams in the world, that is it. I fell in love with it when I was a kid, back in the 70s. All right, we are melting away the herniation right here at the back of this disc. There's a piece of herniation right there. It just popped out and went up. And we're cleaning what's called the annular tear. We're doing what's called a debridement. There's a piece of herniation. We are debriding the annular tear with the laser fiber at the back of the disc, right where the herniation is. We've been doing this surgery here at Deuk Spine Institute for 17 years. And we're coming up on our 18th year in July, July of 24. Will be our 18th year of doing the Deuk laser disc repair. So we've been doing it 17 and a half years now. There's another piece of herniation. We've done over 1,800 of these surgeries. And we keep getting more and more people coming here for the surgery from all over the world. This patient traveled 2 hours, so he didn't come very far. But our last patient came from Brooklyn, New York. And our next patient, I'm not sure where she's from. Ohio, sorry. Ohio. She's a lower back. Sweet lady. Miserable with pain. We're fixing 3 of her discs in her lumbar spine and some of her facet joints because she's having both disc and facet joint pain. So we're going to get to her next. Piece of herniation just shot out there. And a lot of these herniations are popping out so fast you can't even see them. They're literally, you just see the herniation, but you can't even see where it comes from. It's just so fast because they're under pressure from the inflammation. The tear gets herniated. You get a piece of herniated nucleus in that tear, and then it gets inflamed, and the inflammation creates tremendous pressure inside the disc. And that pressure is part of the reason why people have so much neck pain. It's not the pressure itself, but it's the inflammation and pressure together. So when you get in here and you create a little channel for a path of least resistance, those pieces of herniation, they just start shooting out through the tube. And that's what's happening right now. All right, beautiful view, by the way. This is going to be the neuroforamen over here on the patient's right, and looks pretty good. I'm going to go back to the left. That's another piece of herniation. Any questions from our audience?
Yes, we have a question from Vitality Approach on YouTube.
All right, Vitality Approach. Wonderful to have you back with us. This is all scar tissue here from inflammation. Go ahead, Sanjay.
Does the tube cause any discomfort to the trachea afterwards?
Does the tube cause any discomfort to the trachea afterwards? The answer is no. It does not. We never have anybody complain about all right, we're just about done with this first disc. And by the way, I really like doing cervical Deuk laser disc repair when the neck is like this, pretty nice anatomically, not too challenging. And we've had some really challenging necks that we've had to deal with. I still wake up at night sometimes in a cold sweat thinking about them. I'm sure Luis does too. So, all right, just cleaning things up. I have a little bit more to go on this disc right here, the blue stuff. There's a little bit of scar tissue here I got to play with because I got to see if there's a herniation underneath it. Oh, there's another piece right there. Sneaking out. Lots of herniations. It brings up the point that I make all the time. These herniated discs are not one herniation, they're many. You never see just one piece. You always see about 20 or 30 pieces. All right, any other questions?
We have a question from Phil Williams on Facebook.
Welcome to our live stream.
How do you know if the pain is from facet joint or disc?
Yeah, how do I know if the pain is from the facet joint or the disc? Many, many years of experience. That's the basic answer. But facet pain is always to the side. It's always in the back of the neck. And it's worse with rotation, turning your head side to side. Disc pain is not worse with rotation. Looking at an MRI, if someone's neck pain, oh, look at that herniation just come out. You can't tell if someone's neck pain is facet or disc by looking at an X-ray or an MRI. The only way to tell is to examine the patient, which so many doctors don't bother to examine anymore. They don't do the exam. So the key to understanding facet versus disc, there's another piece of herniation out of the foramen on the right at C6-7. You must do an exam, a physical exam. All right, looks like this herniation is hiding back here behind the PLL. So I just peeled off the PLL, going after this big piece of herniation right there. You see that? And
yes, we
look at
do.
it jiggling around. Now the reason it's not coming out is it's scarred right in there in the foramen. And I'm peeling it in little pieces, okay? The reason there's scar tissue here is because these hurt people copying us in the future. All right, we're almost done with the right side. Now I have to move to the left side. Have we played our second video about how the Deuk laser disc repair actually works?
No, not yet.
Why don't we do that? And then we'll come back and take some more questions. Okay, welcome back. You've seen now that the laser is used to find the inflammation within the annular tear and to clean it out. Basically to do a debridement. And that's what we're doing here. We're just about done with this disc. And feel free to ask questions during the surgery. I'll do my best to answer them for you. You could see the fibers of the posterior longitudinal ligament right there. You could see that the PLL was torn here, just shredded right through, and that the herniation was sitting on top of the spinal cord right there. It looks like a crater. But fantastic. A lot of scar tissue right there. The scar tissue is not as concerning to me. If you start going after scar tissue, you're going to hurt the patient. You really just need to get the herniations, and you need to only get the scar tissue Huh? Yeah, you need to get the scar tissue that is socking the herniation down, keeping it from coming out. That's the only scar tissue you need to get. We're done with 6-7. Scope off. We're going to move. Are we? Yeah, we're back, right?
Yes, we are.
So we just did a little irrigation. Cleaning out the area that we were just working on with some antiseptic. All right. Next, we're going to move up to C5-6. To do that, we're going to bring our fluoroscope back in so I can use it to navigate. Any questions?
Yes, we have a question from Janet on Facebook. What can be done for scoliosis?
Janet asks, what can be done for scoliosis?
Yes.
Janet, nothing needs to be done for scoliosis. Scoliosis rarely ever causes symptoms, but doctors will tell you it's your scoliosis causing your pain. But scoliosis does not cause pain, period. What causes pain in the setting of scoliosis is the disc or the facet joint. So we can now cure pain from scoliosis without doing scoliosis surgery. I used to do lots of scoliosis surgery for back pain. And then I found out from treating patients who had scoliosis and they did not want to have the scoliosis surgery, which is, osteotomies and correction of deformity, fusion. They didn't want it. The patients refused it. So they said, I want laser instead. And I said, I don't know. Laser's going to work. You have scoliosis. But lo and behold, the laser worked. It fixed their pain without treating their scoliosis. I envision a day when scoliosis surgery will be only for young people with idiopathic scoliosis, juvenile scoliosis. And I think for older people, degenerative scoliosis, like you probably have, that we're not going to be doing scoliosis surgery anymore. There will be no more fusions, no more osteotomies, no more scoliosis surgery. It'll all be done like you're seeing right now with the Deuk laser disc repair and the Deuk plasma rhizotomy. If you don't believe me, come back in an hour when we do the next surgery. This next patient from Ohio has scoliosis, and it's severe. We're going to go in and we're going to fix her discs. We're going to do a rhizotomy because she has facet pain. We're going to fix 3 discs because she has herniation and pinched nerves. Her scoliosis is probably worse than yours, and we're not going to fix it. And she's going to be pain-free when we're done. Because the pain does not come from scoliosis. It comes from the discs. Shot? Shot? All right. AP? Now with the Deuk spine slide that you just watched me do, 2, 3, 4, 5, 6, the key with the slide is to never take the dilator tip off of the spine, the front of the spine. If you do, you'll let the esophagus slip underneath you, and that will be catastrophic. So you want to always keep the tip of the dilator down on the ALL, anterior longitudinal ligament. And by doing so, you'll never let the esophagus slip underneath the dilator, and you'll never worry about perforating the esophagus, because that's the biggest risk, esophageal perforation. Shot? Okay. We're going to do a discogram. This is number 5-6. Shot? Shot? All right, you can see the tear there in the back of the disc. Shot? Right, thank you. And 2, 3, 4, 5, 6. We're all in agreement. So you can see the tip of the dilator right now is at the back of the disc. It's literally sitting inside the annular tear, right where we want it. We're going to bring the tube down over the dilator. And by the way, we've lost literally 3 drops of blood the whole surgery, 3 drops. If you have an ACDF done, anterior cervical discectomy infusion, you're going to lose 50 to 100 cc's of blood. Shot? Depending on how good your surgeon is. Now, when I did ACDFs, I would lose 15 cc's, maybe 20. I was very good about not losing blood. But most spine surgeons, they could lose 100 cc's of blood. We're losing 0.2 cc's of blood. Virtually nothing. 3 drops. That's it. 3 drops of blood. Any questions?
We have a question from Vitality Approach
I'll get it.
on YouTube.
Yes.
Would facet pain be felt looking up and down or just left or right?
Yeah, facet pain is most reliably reproduced when you're looking left and right. But you can also get it when you look up, not when you look down. The reason is you're loading the facet joints when you're looking up and when you're looking side to side. And that just, for some reason, makes the facet pain exacerbated. Exacerbate means to bring it on. All right, temporarily. Where is my pedal? Uh-huh, destiny. It's your destiny to pay attention and make sure the pedal's ready when I need it. Okay? Let's work on that. Don't be an Oscar.
We have a follow-up question from Vitality Approach.
Uh-huh.
Does the facet pain all the time or does it come and go?
Well, facet pain is arthritis pain. It's otherwise known as osteoarthritis. So like all osteoarthritis, it comes and goes. It can be worse some days, it can be better others. The less you do, the less pain you have. So people tend to not move their necks very much. We had a patient who had facet pain for so many years from Australia that his neck basically, he stopped moving it completely. And when you do that, when you let your facet pain go for too long, what happens is that your muscles get scarred together. We call it a contracture. Contracture, look it up, contracture. It's called a muscle contracture. And muscle contractures are very hard. It's very hard to get rid of muscle pain from a muscle contracture. Okay, it's not common to have a muscle contracture, but that's people who let the inflammation go for a long time, many years. So it's always better to get it fixed right away with the Deuk plasma rhizotomy. Then you can start moving your neck normally and you won't get a contracture and you won't have to worry about it. But what happens is, you ever see these people with really hard muscles? Like quite literally, you touch the muscle, if you've ever done massage therapy, and you touch the muscle and it's hard as a rock. And the reason it's hard as a rock is because they're getting scar tissue in that muscle over time. And it's really hard to get rid of. Okay? Really hard to get rid of. Anyway, so I had a guy from Australia who had that problem. And we fixed his facets, but he had so much muscle pain afterwards. It just lasted for months. And it's getting better, for sure, but it just takes a long time. And patients get concerned and they're like, I don't know what's going on. Yeah, well, I know what's going on. Don't worry. I know what's going on. All right, any other questions? So this is number 5, 6. So far, so good. I will say that I'm a little surprised at how much arthritis is back here and bone spurs. I didn't expect this much based on his MRI, but everybody's different. MRIs really are not reliable in terms of showing you the whole picture of what's going on. A lot of people think the MRI is the be-all to end-all, but it's not. Right, Luis? Here's another piece of herniation. So once again, we're dealing with multiple herniations coming out through the tube. Every one of them we're taking out of the body, getting rid of it for the patient. Look at all that inflammatory tissue. Okay. So far, so good. I'm very happy. I need 5 minutes, doctor. Probably 5 minutes. Could be a little longer than that. Just depends on what I find over here. But let's just say 5 minutes. You know, so you can start getting ready. We'll be done in 5 minutes. Any questions?
We have a question from Vitality Approach on YouTube.
Sure.
Can the facets become swollen and poke in the foramen?
Can the facets become swollen and something in the foramen?
Poke into the foramen. Poke.
Poke?
Yep.
No, they don't poke into the foramen. The herniated discs poke in the foramen. What pokes in your foramen is your disc, not your facets. The facets are in the back of the foramen. They're certainly important. Don't think for 1 minute they're not. So many pieces of herniation floating out.
We have a follow-up question from Vitality Approach.
Sure.
Can the PLL heal? Why was it shredded? Sorry, I missed it.
Oh, why was the PLL shredded? It was shredded because when this patient injured their spine years ago, he tore the PLL and the herniation went out through that tear. It escaped. That's why. So trauma. This is all scar tissue. I'm making my way from one side of the disc to the other along the back. And
we have a question from Mary on Facebook.
hello, Mary.
When I had my C5-C7 done, my voice changed. I sounded like a man.
Yeah.
Can it be corrected? I mean, my vocal cord?
You know, great question. Is that Mary?
Yes, it is.
Mary, what probably happened is the surgeon damaged your recurrent laryngeal nerve, and now you have a hoarseness. But to be honest, I would go see an ear, nose, and throat doctor, ENT, have them do what's called direct laryngoscopy, where they're going to look back there and verify that that's the cause. If that is the cause, there's no cure. But you could have something else going on, like a Singer's nodule or some scar tissue, which might be corrected with a laser. Not here, not with us, but with your ENT. So don't give up hope, but that's why we don't like ACDF surgery, because patients end up having complications like yours.
Celine on, please. Thank you.
We're done. I'm not so concentrated.
Okay.
Let's go far less than it. Should look like just tea. Okay? There's a reason for it. Great question. So most likely your surgeon damaged your recurrent laryngeal nerve or your voice box during surgery, which is one of the common complications of ACDF fusion surgery or artificial disc. My advice is go see the ear, nose, and throat doctor, ENT, and have them do an assessment because it may be a fixable problem. All right, we're done. And our patient is still asleep. He's waking up. Take your time. Take your time. All right, any more questions? Type them up. I'm going to come and answer them for you. But we lost 3 drops of blood the whole surgery. We fixed 2 discs in his neck. We fixed his facets. His pain should be 95% gone permanently. Look at this cut right here. Can you turn the light on, please? I want to have some light here. Okay. Sanjay, are you able to see this?
Yes, I can see that.
All right, let me put this here. All right. And I'm going to show you his incision. Ready?
Yes.
And there it is. You can see it there. Tiny. Tiny incision. Okay, I got this. You can.
Yes, we can see that.
All right, let's get questions typed up. In the meantime, go ahead and take them to one of our patients who just had the surgery done. And it's August 2nd, 2023. I'm Dr. Deuk. I'm here with one of my patients from Croatia who is here in a t-shirt and flip-flops.
Florida.
That's
You
right.
gotta look good in Florida.
Looking awesome, feeling awesome. So now you had problems with your neck before surgery yesterday.
Yes.
And why did you come to Deuk Spine Institute?
I had an injury when I was 19. I guess that's 23 years ago. And I've always had chronic pain as a result of a disc problem here in my neck. And I thought someday I'm going to have to get this fixed. Recently I started getting numbness in the fingers because the disc was pressing on the nerve cord, I guess. And I went to a neurosurgeon in Croatia, and they recommended spinal, the vertebrae fusion to protect this area and to solve the problem. And my wife was not satisfied with this recommendation because she had a feeling there was something space age and some new technology out there that could benefit me, and she was certain that this was not right for me. So she went to Google and she Googled the 20 best spinal surgeons in the world, and she read about all of those 20 people listed there, and on there was the Deuk Spinal Institute. I'm not sure where you were in the 20 of the 20.
Probably number one. I'm
yeah, sure. Most likely.
But I do want to say, because we are in the space coast of the United States.
Yes, exactly. Yeah, this is where they launched.
This is space age surgery.
This is space age surgery, and I'm so grateful to her because she was certain that this vertebrae fusion was a primitive, old-fashioned operation that we don't need anymore, and she was correct. My first contact with your people was so positive, and I felt really good and encouraged that this is the right thing for me. So we set it up and got a plane ticket, and I flew here to the Space Coast. We're staying on the beach. My mother came down from Pittsburgh. I'm originally from Pittsburgh, but I've lived in Croatia for 20 years. I feel great today. I notice already my neck feels better and the shoulders feel better, so it's still a little sore, but I can tell it's not the same. So I can tell that there's some improvement. I can feel that in my left hand this numbness is less already. I know that might take a little time to get 100% improvement, but I feel really good about my decision and really great about I would recommend you to anybody else who's suffering any kind of disc problems in the neck.
Well, I used to do the fusions for 20 years. I've done 1,000 patients with fusion.
Wow.
And as a matter of fact, you can watch them on our YouTube channel because I've got hundreds of them. And we do them outpatient, where you go home an hour after surgery. But
Unbelievable.
The difference is with fusion, you're putting metal in your spine, you're losing movement permanently the rest of your life. The metal stays in there. It causes swallowing problems, it causes a voice to change, it causes scar tissue, and then it causes adjacent segment disease, meaning you have to come back again a few years later and do the next disc above and below because they wear out faster once you do a fusion. So all of that is just problematic for patients, and it causes ongoing issues. But with the Deuk laser disc repair, you can see we did a 4mm incision on your neck, tiny, and we went through a little tube to the back of your damaged disc where the problem was, pinching the spinal cord, irritating the nerves, and I used a laser to break the herniation up into little pieces, and we sucked them all out. I even showed at the end of the surgery on the blue towel, you could see all the little pieces of herniation there that came out from your herniated disc. At the same time, we left the entire front of your disc normal and alone, so you can keep using your normal disc that God gave you.
Wonderful.
Isn't that great?
That's beautiful. What made me a candidate for this instead of the fusion?
Well, everybody that needs a fusion would get the Deuk laser disc repair. Deuk laser disc repair, the endoscopic procedure, could replace all the fusions being done in the United States.
Wow.
From degenerative conditions, but not like fractured dislocations. If you get into a high-speed car accident, your spine is barely hanging on, you want to get a fusion for that. But 96% of spine surgery done in the United States is for degenerative conditions like yours. They would all be perfect for the Deuk laser disc repair.
Well, if I may state my humble opinion, I feel you're doing God's work.
I agree.
So I think that what you're doing is fabulous and wonderful, and I'm grateful that I came here and that you fixed me up.
I
So
thank you,
for
and,
that.
and I know you're going to be happy with the results. Is there anything else you want to tell your fans out there?
Yeah, just I'm feeling really good, and thank my wife. I gotta give a shout out to my wife. Without her, I would just take what's there, you know. But she
Absolutely.
really did the research and found the best place in the world to get this problem resolved, and I'm grateful to her.
And if you're ever in Croatia, come and visit
Yeah, if you're
this
ever
guy.
in Croatia, yeah, we're very hospitable over there, and we'll have a good time together.
What are you doing in Croatia?
So I'm an executive coach. I teach managers how to manage people.
Oh, wow.
Yeah.
We may need to hire you here.
Yeah, I see your management style, but you know, everything is appropriate to the setting. So because of the high stakes around here, a different management style is appropriate than more wouldn't fit in other places as well. So I have been observing your management style, and I quite like it considering the setting we're in. So
I appreciate you saying that because you're very kind with your words.
yeah,
My management style could definitely get improved. God gave me certain gifts, and patience and management is not one of them.
yeah, but the stakes around here are high, so we don't need to have a lot of discussion about things.
I can't have mistakes, you know, because they affect the patients and their outcomes, and that's all that matters is great outcomes.
So I respect the way you're running a good ship around here. People are doing a great job. Your people are excellent. So I should also give a shout out to them. So
means a lot to me. Thank you so much.
Thank you, Dr. Deuk.
All right, you take care.
Yep.
Safe travels back
Thank
to
you.
Croatia.
Thank you.
It goes to Davis. Hi there. All right, we're just wrapping up our procedure here that we did on this patient, and we kind of broke it up into two separate surgeries that we broadcasted, though it was really one surgery. We started by treating the facet joints in the back of the neck. Our patient had pain, and this, if you looked at him before surgery, he went like this, and it was like, ow, it hurts. Where does it hurt? Right there. Well, I figured out which facet joints it was. It was a couple that we treated in the back. And if you look here at the facet joints, you could see that there's a nerve that comes around the side here, on the side of the lateral mass, and then it goes up and innervates the facet joint above and below. So basically, I burned that nerve during the Deuk plasma rhizotomy. We just cut it and killed it. That's going to take care of the facet pain permanently. We still have the two discs we had to deal with, so we came from the front and we treated those two discs. And everything went really well for him, didn't have any problems. You could see that in his case, the bottom disc, C5-C7, appeared to be the worst one. There was so many herniations, probably around 25 to 30 pieces of herniation at C5-C7. There were fewer herniations at C5-6, maybe 15, about half as many. So more herniations at the bottom disc, less herniations at the top. Impossible to tell based on the MRI. MRIs do not let you see individual disc herniations, but the endoscope does. So everything went perfect for him, but we had to flip him over and do the front, and I went through a tiny 4mm incision on the front. You guys saw that at the end. 3 drops of blood the whole surgery. This is bloodless surgery, folks. Bloodless surgery, no hospital stay, outpatient. The success rate is almost 100%. I've literally had no failures in 17 years of doing this, 1,800 patients. All right, I heard we have some questions.
Yes. We have a question from Big John on YouTube.
Hello, Big John.
For people with disc that are naturally fused, would that cause a natural adjacent disc syndrome for this kind of fusion versus, say, what ACDF might do?
Great question, Big John. The Big John is asking, hey doc, we know that when you do a fusion of two bones, you fuse the disc, and that's going to put more stress on the discs above and below, the facets above and below, where the fusion is. You do that fusion, you get more pressure on the discs and facets above and below. Does the same thing happen if somebody has a natural fusion, where they fuse themselves? The answer is yes, it does. Absolutely. Anytime you start subtracting the workers in a workforce, it puts more work on those that are left over. So if you think about it, you've got C2-3, C3-4, C4-5, C5-6, C6-7, and C7-T1. So you've got 6 discs in your neck. If you start fusing discs, say take away 2, then you're left with 1, 2, 3, 4 discs that actually move, right? Well, if it used to be 6 discs doing all this movement, and you take away 2 of them, now you've got 4 discs to do the same amount of movement. And so of course they wear out faster. And it doesn't matter if it's a natural fusion or if it's an artificial fusion from a surgeon. Those joints are going to wear out. Thank God there's not too many natural fusions that happen.
The next question is from Vitality Approach on YouTube. If you get the plasma rhizotomy, is it okay to go back to sports with a lack of pain, or would that worsen the damage just without pain?
Yeah. So Vitality Approach, 100% go back to sports after your treatment. If you have no pain, go back and enjoy, do everything you want to do in life. What's happening is your joints are going to continue to degenerate no matter what you do. Whether you go out and you play sports or you don't, they're going to degenerate. Because it's not a mechanical problem. It's more of an inflammatory problem, okay? And so I encourage all my patients, once they're healed for an appropriate amount of time from their surgery, they should go out and do everything that they want to do. Live life to its absolute fullest. You are not going to make the joint any worse than it can possibly get. We've seen arthritic joints that are 100 years old. We've seen arthritic joints that are 110 years old. And they don't look much different between a 110-year-old arthritic joint and a person who's 60. All right, it's about the same, even though it's almost twice as long that they've had that joint for. So you're not going to have a failure of your joint mechanically. You're just going to have no pain, and you're going to be able to enjoy life. And that's what I recommend you do.
The next question is from Vitality Approach. Why do 10 to 20% of patients with bulges also have facet pain?
Vitality Approach is asking, why do 10 to 20% of patients with disc bulges also have facet pain? The reason is because if you understand that this is a traumatic disease, it comes from trauma. To get trauma to the disc, you have to really rip the bones and twist the bones suddenly, and you have to overload the stabilizing ligaments and tendons. When you do that at the disc, you're also doing it at the facet. It's not just the disc that moves, it's the facet that moves as well. In other words, you cannot move your disc and fracture your disc without also fracturing your facet capsule. So any movement at the disc is also happening at the facet joints, not just the disc. So if you rip really hard the disc, you're also ripping really hard the facet capsule. That's why. It's a single unit. We call it a motion unit. The disc and the facet together are a motion unit.
And the last question is from Ali Cameroon on Facebook. Can facet pain develop many years after a traumatic event?
Yes, Ali. Facet pain can develop years after trauma. As a matter of fact, that's when it happens, is years after trauma. Facet pain rarely ever happens right after trauma. You'll damage the facet joint right after trauma, but then the capsule of the facet will tear, the pain will go away almost immediately, and then after years of movement with the broken capsule that never heals, you eventually create inflammation in the edges of the capsule, which spreads to the facet joint, and you get this instability picture with the facet getting bigger. It's called facet arthropathy, hypertrophy. You'll see it on MRI reports, facet hypertrophy, arthropathy. That's the facet joint getting bigger in an attempt to stabilize itself because the capsule is ripped. So the capsule used to hold the facets from moving too much, but when the capsule's torn, now the bones are moving all over the place. They're causing stress, which according to Wolff's law causes bones to hypertrophy. So, you know, the arthritis pain of a facet joint, it almost always happens years after the injury.
So, if you
Any joint, as a matter of fact. So, I'll give you an example. I was bike riding. I hit a cat at night. Didn't see it. I landed on my hand. I flew over my handlebars, landed on my thumb, and I had some pain here. I smacked my thumb really hard. That was years ago, 5 years ago. Now I'm starting to get arthritis pain in the joint. And so that's very common, is you traumatize your joint, and then many years later you start getting the ridges of the bone start getting thicker, bigger, hypertrophy, and you start getting pain in the joint. And it just gets worse and worse over time. So rather than lose your function of your thumbs, you take away the pain and you preserve the function and the movement. And that's far better than losing the function. Same thing with your facet joints.
if you get a trauma, is there anything you can do right away to save the facet capsule and the disc?
So the question is, if you get a trauma to your facet or disc, is there anything you can do right away to preserve the integrity and prevent it from progressing? That is a great question, and I do not know the answer. I don't know everything. I've been piecing it all together for the last 20 years, and I don't have an answer for you on that. I've never really thought about it. I'm sure there's something you can do to minimize the progression of arthritis or slow it down, but I don't know what that is. I'm not aware of anything that would do it, that would slow it down. I'm not aware of anything. I'm sure there's something out there. I haven't put much thought into it. I haven't really investigated it myself, so I don't really have an answer. I just don't know.
Okay, and that's it for the session.
All right, I hope you enjoyed. We'll be back with a patient with a really, really twisted spine from Ohio. She's an older lady. She has rheumatoid arthritis. She has osteoarthritis, both. And her spine is super scoliotic. But we're not going to fix her scoliosis. We're literally going to go in and repair 3 discs and fix 2 facet joints, and that's going to get rid of her pain. And I'll show it to you. We do this all the time. You don't need scoliosis surgery. If you have scoliosis, don't get surgery to get it fixed. Just come here, let us fix where the pain is coming from. If you have listhesis, where the bones are slipping, you don't need a fusion. Okay, we can now fix pain from listhesis by using the laser endoscopic surgery. Don't let these surgeons talk you into fusions when you don't need them. Get an opinion from Deuk Spine. Even if you don't have surgery here, it doesn't matter. I'll give you our opinion for free, and you can do what you want with it. Some people will go on and have fusions anyway, just because they believe that's what they need. But I used to be a big fusion surgeon. I just did fusions all the time. Big, long fusions, through 2, 3, 4 levels, more. And I was a believer in fusion technology until I had my awakening, and I realized that the laser surgery fixes all those problems without having to do invasive surgery. All right, we'll be back soon.